Good afternoon, and thank you for joining us today. My name is Lendy Ruano, and I am here with Eastern Seals of Southern California and the Disability Tribe Initiative. Today's webinar, Gain COVID-19 Vaccine Knowledge and Support Strategies to Use During Alternative Services, will be offering Spanish and ASL interpretation. For those of you in need of Spanish interpretation, please click on the white globe at the bottom of the screen labeled Interpretation. Then click Spanish and you will have the choice to mute original audio. You will then be able to hear Ruben Diaz provide a live and simultaneous interpretation of the webinar. In the Spanish channel, if you select Mute Original Audio, you will only hear the interpreter. Otherwise, if you don't select Mute Original Audio, you will still be able to hear the English presenters in the background. Our ASL interpreters today are Monica and Francesca. They have been spotlighted so they can be seen throughout the presentation. Depending on your device, this may mean that sometimes you cannot see the presenters. We apologize for the inconvenience, but we want to make sure that this meeting and recording can be accessible to everyone. This presentation will have closed captioning, which you can access by using the button at the bottom of the screen. Next slide, please. A few things to note about Zoom before we get started. This meeting is being recorded to allow us to refer back to the discussion today and the input we receive. You can hear and see us, but we cannot hear and see you. Everyone has been automatically put on mute and your camera is not on. Chat is not activated for attendees. However, presenters will be sharing some information through the chat during the webinar. If you would like to ask a question or provide a comment, please use the Q&A feature at the bottom of your screen. We also ask that you indicate which presenter you would like to send the question to. We have staff monitoring and responding as necessary. Some questions will be answered in real time. Some will be saved for the live Q&A at the end, or we may ask for your email address so we can follow up with the more thorough answer after the webinar. For those of you on a phone or a device, you may not be able to use all of the features we discussed. We will be providing other options for you to access material or ask questions later in the webinar. Finally, at the end of today's webinar, we will be asking you to participate in our post-event survey. Once the webinar is over, a new window will pop open with a survey. Please provide your feedback so we can improve on future events. Now, it is my pleasure to introduce Amber Carey Navarrete, Director of Person-Centered Services at Eastern Seals Southern California. Amber?
Thank you, Lendy. And thank you to all of you for joining us today. As you can see, we have a packed agenda full of information to educate the disability community, our community, about the COVID-19 vaccine. All are welcome here today. I do want to let you know that today's webinar will have portions focused specifically on how the providers in our community can support education and access to the vaccine through alternative services. We have more to come in a few weeks regarding the vaccine, specifically speaking to our community at large. I will share more on this towards the end of the webinar. Today we will discuss, as you can see here, partnerships for vaccine access, the benefits and risks of the vaccine, the tiers and what they mean for us, post-vaccine symptoms, and again, how alternative services can be used to support those who choose to get the vaccine. Next slide, please. Without further ado, I would like to introduce Reina Zavala, Program Director at Eastern Seals El Centro, to speak on her experiences supporting COVID-19 education and access. Thank you, Reina.
Hello, everybody. Can you guys hear me? Well, I wanted to speak to you regarding my experience at the El Centro office in El Centro, California, and the way that we started educating our family members and individuals we support was through information sent to them via email, via Zoom, in person, giving them printouts from the CDC website and also from our internal health and safety department. We did that continuously, and we called the individuals as they had any concerns or issues, or as they were hesitant to take the vaccine. We called them to hear their concerns and empathize with the situations they had each at home. And we were able to accommodate their needs in order for them to have an easy process during vaccinations. We provided 3 different dates for vaccination clinics. We were able to provide transportation for them, get them transportation, support them during the vaccination, assist them with documentation, get the documentation to them, and so that the process could be easier for them. And we worked with their schedules so that they were able to come and attend all the vaccine clinics. We also continually shared our personal experience, my personal experience. All our staff shared their personal experience so that as people get comfortable knowing the supervisors, coworkers, my neighbor, my sister got vaccinated and they are fine, the people get motivated in order to continue that process. And the more we spread out the word that we're taking the vaccine and getting immunized, the more people that will get motivated into taking the step into taking a vaccine and deciding on their own whether or not they want the vaccine. We had 3 successful clinics here in Imperial Valley and throughout the Eastern Seals regions. And all the families were very, very happy and grateful that we were able to accommodate their needs and the times for them to come to our program and get the vaccination here. It was a smooth process throughout the 3 different dates, and we were able to help everybody and share our successes. I wanted to share with you guys, I had a family here in Imperial County that the care providers decided to take the vaccine the first day of our clinic and went back home. A couple of days later, she called me and said, can I set up the rest of the family and the individual that we serve in order to get the vaccine? And sure enough, the whole family got vaccinated thanks to our clinics here in Imperial County. And there's much more stories like that here in Imperial County where everybody got motivated once we did the first clinic.
Thank you so much, Reina. I really appreciate you sharing your experience and what it was like kind of helping all the way from the beginning to the end there, with starting with some of that hesitancy you've seen, providing the education, and then being able to support people all the way through their vaccination. And if you want to continue to ask questions for Reina, we will be having more question and answer and more conversation regarding this at this Friday's Lunch and Learn. And we will have links to sign up for that at the end of the webinar. Now, to educate us all on the COVID-19 vaccine, we have with us speakers from the California Department of Social Services, Community Care Licensing Division, Adult and Senior Care Program, along with a few of their partners. But before they get started, we would like to take a quick poll. Launch poll, please. What we would like to know is, are you a provider licensed by the California Department of Social Services Community Care Licensing Office? Your options are yes and no, or not sure, and the poll, for your information, is anonymous. like half of all of you have voted, and it's actually about 50-50. So that's very interesting. We will share these poll results in just a moment here. All right, we'll take just about another 5 seconds for the poll. We're at about 68% of attendees today voting. Okay, I think we can go ahead and end polling now and share those results. So as you can see here, about 40% of our attendees today here are licensed by the California Department of Social Services Community Care Licensing Office, 48% not, and some people aren't sure, which is also fine. So thank you all for being here, and thank you for participating in our poll. Now, I would like to introduce Dr. Vicki Smith, Program Administrator with DSS, to introduce the team and to help us to gain a better understanding of the COVID-19 vaccine. Thank you, Vicki, for being here.
Yeah, thank you, Amber, and thanks to all of you for participating. It's an honor to be here on the behalf of the Department of Social Services in support of our sister agency, the Department of Developmental Services, and their Disability Thrive initiative. So real honor to be here. It's also an honor for me to introduce our panel today, who have been presenting along with myself and others for our licensed facilities as we came out of this come through this pandemic and through the vaccine process. So as Amber mentioned, I'm the statewide program administrator for all of adult and senior care programs that are licensed with community care licensing. Today, we also have presenting Josh Allen. Josh is a registered nurse and a board member for the California Assisted Living Association and a primary principal for Allen Flores Consulting Group. We also have with us today Dr. Janice Hoffman. Dr. Hoffman has her doctorate in pharmacy and is also an associate professor for the College of Pharmacy at the Western University of Health Sciences. And we also have Claire Matsushita. She is one of our assistant program administrators for community care licensing and covers the Los Angeles counties, including the tri-counties of San Luis Obispo, Santa Barbara, and Ventura. And she actually started her career, as did I, working for one of the regional centers. So real thrilled to be here and to be able to help provide some guidance for services specific to the IDD community. So next slide, please. Today, the 4 things our panel will be going over, and we'll be taking questions and answers at the end of our panel as well, is the first one is the current timeline for the vaccination tiers, the allocation and access needs. And then also the second, some explanation of the vaccine hesitancy and readiness and how you go about getting the vaccine, or if you're working with folks who have some hesitancy, maybe some tools that might help in helping to explain the vaccine a little bit more to decrease the hesitancy. The third is also distinguishing between COVID-19 symptoms and then what post-vaccine symptoms might look like as you start to put together kind of some assistance with your staffing and what they need to keep an eye on. Also putting together your own side effect monitoring plan and what that might look like. So next slide, please. I will toss it over to Josh Allen. And again, thanks for having us.
Thanks, Vicki. Thanks, everybody. Appreciate being here. I want to talk a little bit about vaccine hesitancy and some of the things you might think about to overcome that. That certainly has been one of the questions or challenges we've faced with the vaccine rollout, is particularly early on. You think back to like early January, a lot of people were hesitant and had understandable concerns about being vaccinated with these new vaccines. The thing, of course, that we have to emphasize is to get through the pandemic, to get where we all want to be. Dare I use the phrase back to normal, which I know we're all, we get scared to even say it. We need to get vaccinated. It's really that simple. We need as many people as possible in the United States and around the world to get vaccinated. And this image that you see here on the screen, I think it gives a great kind of visual representation of why that is. What you're looking at here is the bodies or the silhouettes in red. These are people who are not vaccinated and they are sick with COVID and contagious. The people in blue are vaccinated and healthy. The people in gray are healthy, but they haven't been vaccinated yet. And so you can see if only some of us get vaccinated in this first picture here, it's just, 2 or 3 people in that group that got vaccinated, that leaves a lot of potential for the virus to spread to all of those people who chose not to get vaccinated. Whereas on the right, visually, you can see it quite clearly that when we get a lot of people in a group vaccinated, it helps to contain the virus. What you hear a lot in the news is herd immunity and that kind of stuff. And I honestly would encourage you not to get too caught up in all that. That stuff that the scientists and the epidemiologists can really focus on. Our message is simple: get as many people vaccinated as possible. Next slide, please. But again, there are some people that are hesitant, and that's understandable. This is new. It's yet another phase of the pandemic that everyone is having to really, grapple with and come to terms with. Early studies are showing that there are certain groups of people who are more likely to have hesitancy about being vaccinated. This includes women, persons under age 55, persons that are from low-income backgrounds, as well as those who are not college educated. We also see that rural residents, as well as people who are in Black or Latina communities, those folks are more likely to have hesitancy. Next slide. Some of the reasons people will identify for why they're saying, I'm not sure I want to be vaccinated or not. Some people will tell you it seems rushed. The vaccine came too quickly. People may question whether it's effective, although we do know the studies have shown that these vaccines are in fact highly effective. Because it's rushed and because it was done quickly, people may feel like they can't trust it, like perhaps the vaccine is not safe. They might be worried about side effects or long-term effects. That's one I hear a lot when I talk to people who are hesitant. Is they say, well, what's going to happen, 2-3 years down the road? Is this vaccine really safe? And lastly, I think we can all kind of sympathize with this. There's that sort of feeling of it's become too political. And, for that reason, people are just like, I don't want to be involved in this. Next slide. So what do we do about that? I think there are some very real, practical things we can do to try and address legitimate hesitation. Number one is to be respectful and really understand people's concerns. And I have to be honest, I struggle with that one. As a nurse, I want everyone to get vaccinated. As a nurse, I went out and I got my vaccine just as quickly as I could. So I've got that prized vaccine card, and I'm telling my family and my friends and everyone I can, go get vaccinated. But it is important that we don't just sort of, run over people and ignore their concerns. People have the right to be worried. They have the right to be afraid. So rather than, arguing or sort of becoming defensive, I think we want to try and really focus on what people are feeling and what kind of information we might provide to help them work through those concerns. One of the first things you can do is provide written material on how effective the vaccines are and how safe they are. I would urge you to check out the CDC's website. If you just Google CDC COVID vaccine, it will take you to their section of their website on the vaccine. They have a wealth of information written in very simple terminology and available in a variety of languages. So you can use that to help educate, staff members, clients, participants, family, friends, whoever you're working to educate. Provide positive testimonials from respected staff member, people receiving services, clients or residents, community members. And this, I think we're seeing this. Particularly early on, there was a lot of hesitancy. Like I said, early January, a lot of people saying, I don't want to get vaccinated, I'm going to wait. We've really started to see that change, in just what, three or 4 months that the vaccines have been available. We're seeing a lot more adoption. I think we heard this earlier addressed by Raina, that they're seeing their friends, their families, their coworkers get vaccinated. They're seeing that they're tolerating it okay, not having any real problems, and that's motivating people to go do it. So that personally, I've seen that be the most effective. Let them talk to friends, family, colleagues, coworkers who have done it and feel fine, and that often seems to help. Make sure to check in around the time of vaccination. So if you have vaccine clinics being scheduled on site, make sure that we check in around the time that that's going to happen. So we can, how are people feeling? Do they have any concerns? Provide that reassurance. I know in the facilities I work with, we had vaccine clinics. Many of them have had multiple vaccine clinics now. And we saw a lot of people the day of the clinic change their mind. They were like, you know what? I see all these people doing it. I want to go get my vaccine too. Fortunately, we were typically able to accommodate that, but sometimes there is a limited number of doses. So we want to talk to people in advance so that if they're changing their mind, we can coordinate with the pharmacy. And of course, use good judgment when you're educating people. Don't get too far ahead of yourself. I don't think anyone on this call, other than maybe Janice, is a real true expert on how vaccines are produced or sort of the medical side of it. So I think we want to make sure we refer people to the CDC, to their doctor, to their pharmacist when they have those really detailed clinical questions that might be beyond our scope for some of us. I'm going to turn it over to Claire Matsushita with the Department of Social Services, and she's going to talk about vaccine prioritization in groups.
Thank you, Josh. That was wonderful in terms of your overview about vaccine hesitancy. I'm going to talk a little bit about who's eligible now to get the vaccinations. The good news is, as of March the 23rd, about 4.8 million people had gotten partially vaccinated. That's about 15% of the population in the state of California. We had about 5 million individuals who were fully vaccinated, and that's about 16%. We've got a lot more people to go. Right now, and it has been since the beginning of January almost, we've had 2 phases. Healthcare workers, long-term care residents, and individuals 65 and over. Starting in probably the beginning of March, we added people working in specific sectors, education and childcare, and that includes foster care, children's residential facilities, emergency services such as utility workers, disaster services workers, and then also food and agriculture. It also includes individuals, yes, next slide, thank you. Beginning in March, and this is the exciting news, healthcare providers may use their judgment to vaccinate certain people aged 16 to 64. These people must be at the highest risk of serious illnesses and death from COVID-19 as a direct result of one or more of the following severe health conditions. Next slide, please. I won't go through the list because it's pretty extensive. We've got resources where you can look up which of these conditions will qualify or make somebody eligible to get the vaccine. It is sufficient to say is that most of the counties and most of the healthcare providers who are approved to give vaccines are really trying to be as inclusive as possible. So next slide, please. Okay. As part of the new group, not only are there with serious health conditions, but it also includes a group of individuals with developmental or other severe high-risk disability. If one of the more following applies, the individual is likely to develop a severe health-threatening illness or die from COVID-19. Getting COVID-19 would limit their ability to receive ongoing care or services vital to their well-being and survival. Providing adequate, timely COVID care would be particularly challenged because of the individual's disability. That being said, it's basically, again, trying to be as open and as inclusive to include any individual with a developmental or severe high-risk disability. Next slide, please. What I've included, and you're going to see copies or being resources in terms of how you can access a similar letter from either the Department of Developmental Services, excuse me, or your regional center. But this is a sample of a letter that is specifically for individuals of in-home support services who also meet the criteria to be vaccinated beginning March the 15th. The real caveat, as it says, is the vaccine supply is available, if the vaccine supply is available. Next slide, please. That being said, it's really important. I'm going to tell you a couple of different ways, options of getting the vaccine. If somebody is saying they can't see me, I apologize. There are 5 main ways to be able to find an appointment. From your healthcare providers, from a pharmacy, a local public health, a community pop-up clinics, what we're known as the megapods, or calling online, which is the myturn.ca.gov, or by telephone. There's a phone number here, 1-833-422-4255 if you're not able to have access to the internet. One other little thing that I want to add is that your pharmacy, like Rite Aid, Rite Aid or other CVS or Walgreens are doing clinics at their stores. And it looks like I just was having my technical difficulties, so people were not able to see me. I apologize for that. And now I'm going to turn it over to Janice.
Hi, welcome. I want to get you prepared for what's going to happen when you get the vaccine, or when you're dealing with people who aren't sure about the vaccine. Make sure that you don't intimidate them. You got to get this vaccine. No, we want it to be their decision to get the vaccine. And with some of our clients, they will ascend, which will say they'll raise their hand and say, yes, I want to get the vaccine, rather than write a consent. And that's okay. They can ascend, not necessarily consent. We want to include vaccine in the care plans. So if there is a care plan in your day program or in your facility or in your program, you want to make sure that the vaccine is included in there. You want to collect, if you're going to take a client to the pharmacy or the pharmacy is coming to your program, make sure that you preempt with all the information that they need from you before they come for the visit. You want to set up a way to track who will receive the vaccine, whether it's staff, whether it's clients, whether it's multiple people. We need to track that. And you want to make arrangements for the consent, whether it's assent or consent. And there's a fact sheet on the CDC website that you should download and print out for them. Also, you want to follow these guidelines. Make sure you're not sick or they're not sick or feeling ill. Make sure that when you're running the clinic or being ready, helping people, that you are hydrated, and do not drink alcohol the night before, or you will feel very dehydrated. Wear loose fitting clothing because you're going to be running around a lot and helping patients and clients, and to write down any questions you may want to ask of the provider giving the vaccine. So next slide, please. Vaccines may trigger a seizure. And so in this particular population, we need to be very cautious about being prepared for anything, but particularly in this population for a seizure. So we want to have anti-seizure meds available. Some clients who are unstable with their epilepsy or their seizure disorder will need to take clonazepam orally before they have the vaccine. Others, you may need Diastat, which is rectal diazepam after the vaccine for treatment of a tonic-clonic seizure if they should have one. The important thing here for you to do is to work with the neurologist to develop a plan for each individual person with the seizure condition so that it's all planned out before they get the vaccination. Next slide, please. All right, what about the side effects? When do we see them from vaccination? So usually the side effects are seen within the first 3 days. Day 1 is the day of vaccine. So, and what we see is, for the most part, they're resolved 1 to 2 days after. And I want you to think about this. If you get the disease of COVID-19, you could die. If you vaccinate, if you get the vaccination, the side effects will last 1 to 2 days, but you're not going to be in the ICU with severe illness. That's the choice that I bring up to most people, is you can be sick for 1 to 2 days, not feel great, but you're not going to end up in the ICU. And that's the beautiful thing about the vaccine. We see more side effects in young people, less than 55. Some people over 55 will get symptoms of or side effects from the vaccine with the second vaccine, not the first dose. Side effects are really a positive sign. That's telling us that your immune system is working and working against the virus. Next slide, please. So what do we see as side effects? In younger people, well, in everybody, you're going to see a sore arm. Some people more sore than others, where you might not be able to lift up the arm. Could get headaches, body aches, kind of like the flu, body aches, kind of feeling achy all over, fever, upset stomach. In older people, we tend not to see as much of the fever. And if they do get a fever, it's usually low grade. Versus younger people, you're going to see a fever of maybe 100, 102. Sore arm, of course, and then fatigue. So older people, they don't get as much of the side effects as younger people because their immune system doesn't work as well as younger people. Having had the vaccine myself, I had a sore arm and I had fever and chills. I will tell you, all of it is resolved with just 1 dose of Tylenol. We want to use acetaminophen or Tylenol because the other agents, such as ibuprofen, will interfere with the effectiveness of the vaccine. Next slide, please. So make a plan on for side effect monitoring. Check in with the participants and the clients and their caregivers as to what's going on. Why? We want to decide whether there's symptoms of the vaccine or if they have active COVID, or it's really unclear what it is. We want to avoid unnecessary testing and quarantine if they don't have COVID-19. So we want to keep people with COVID-19 separated and from giving it to other people. Next slide, please. All right, what about staffing? Well, staff need to understand about the vaccine and the side effects and how to handle them. And the second thing is to develop a strategy to provide assessments of staff with symptoms. We want to, if you at all can, offer paid sick leave for staff with symptoms to remove the barriers of reporting whether they have disease or whether they have side effects. We have to have a backup plan for staffing in case staff call in sick, especially after the second dose. After the second dose, they are likely going to have a fever and shouldn't be working because they're not going to be up to their normal selves. So having that backup plan, having it staggered so that staff are not all getting the shot on the same day is of your best interest. Next slide, please. All right, what about reporting side effects? The best way to report is using a website, signing up for vSafe. vSafe is a way to get text messages on the phone to fill out a questionnaire about side effects, and it sends the instructions. So all you have to do is go to the website and check, just type in vSafe, and it will pop up on your computer and be able to put in the phone number and your dates of vaccination, and it will send a text message which will go directly to the CDC. Next slide, please. All right, how do we tell a positive COVID test from the vaccination side effects? Well, guess what? These vaccines do not give a positive COVID test. Only someone with disease of COVID-19 will test positive for the disease state. It is not at all related to the vaccine. Next slide, please. So what are the symptoms of COVID only? When we look at COVID only, they're mostly respiratory, shortness of breath, cough, runny nose, sore throat, but probably the key here is loss of taste and smell. If they can't smell or taste, it's likely COVID. What do we do if they test positive? If we don't even have a test, but they're showing symptoms, they need to isolate. Full PPE, protective equipment for contact. If they're positive, they need to be away, whether it's a client or family member or staff, they need to be away, and they need to get a COVID test. Staff cannot work, period, and they have to get tested. Next slide, please. So what about fever, chill, fatigue, muscle aches, joint aches? Can we tell if it's COVID or the vaccine side effects? No. So what do we do? If it's a participant, we want to quarantine and monitor. We have to consider PPE for them and COVID testing. If the symptoms are gone in 2 days, it's probably vaccine related and they can go back to normal activity. If it's staff, can they work? Well, if there's no fever and they feel good and they're willing to, and there's no COVID only symptoms, they can go ahead and work. Okay, next slide, please. So this is a nice slide to look at the difference between the two, vaccine only, COVID only, and the overlapping symptoms. Vaccine only, local pain, so to the arm, swelling, allergic reaction will happen only within minutes of getting the vaccine. So when you get the vaccine, they will make you wait there 15 to 30 minutes, depending on your risk factors for allergic reaction. If it's COVID only, it's going to be cough, shortness of breath, runny nose, sore throat, and loss of taste and or smell. The overlapping symptoms will be fever, chills, headache, fatigue, muscle aches, and joint aches. These we're not sure if it's going to be COVID or if it's due to the vaccine. Next slide, please. So I'm going to turn this over to Vicki to finish up.
Great, thanks, Janice. What a great overview. Wanted to just share with folks some resources that we've kind of referenced, but also resources that you can take a look at on your own. While this first resource is a toolkit for long-term care facilities, it also has really good information about how to kind of put a program together for yourself, maybe even in your own home with your support staff that are coming in. Also has some really good frequently asked questions from the CDC about vaccine issues. Janice went over a number of the symptoms that are related to COVID, and then a number of the symptoms that are related to the COVID vaccine and how to see the difference. And so if you'd like kind of one-pagers on that, you can find those under the after vaccine symptoms. We also wanted to make sure that we provided you some helpful hints in case you're having folks that are having some hesitancy who would like to know more information. And then underneath the promoting vaccine confidence section, you'll see a number of different toolkits, some of which are in plain language, which are much more easier to understand, or picture-based. That can help folks kind of understand a little bit more about the vaccine and if that's their chosen path that they would like to receive that. So with that, we can advance the slide and open it up to folks if you have any questions that you'd like to pose. We've been trying to capture those as they've been coming through the Q&A, but for any other questions, we can take them here.
Thank you so much for being open to the Q&A. We are not taking questions live from the audience since that feature isn't enabled, but please do share some. I see that your team has been busily working behind the scenes to answer the Q&A that has been coming through the Q&A feature. So I want to open it up to all of you. Has there been a particular question that you saw that you think really has appeal or you know, that a lot of people may share? I've seen quite a few come through just even about not knowing some of these things like using ibuprofen, right? So maybe speaking a little bit to the questions that you think have broad appeal and will help to educate.
So I'll go ahead and start with that. There's a couple of questions. One question was, is the one dose Johnson & Johnson have the same side effects as the other mRNA vaccines? Yes, for the most part it does. So it's still the same, it lasts a couple of days. The effectiveness is a little bit less than the other two vaccines. However, it's still significant enough to be beneficial. So we're talking about 80% effectiveness versus 95% effectiveness. That being said, the Johnson & Johnson vaccine is only one dose. So for some of your clients where that might be easier to only go in once, it may be the choice. I also want to compare this to the flu vaccine. Just so you know, the flu vaccine is only 60% effective, and we take it every year. So just to let you know, these are much more effective and have been tested much better than the flu vaccine. And we change the flu vaccine every year. So I think this is a real positive one. The other question was about ibuprofen. Ibuprofen has the ability to make the vaccine less effective. That being said, from 95% to 92% may not be significant for most of our population. If you absolutely have to take ibuprofen over acetaminophen, then you need to do so. I think that answers most of the ones.
Janice, I think there was one question that if you could maybe chat a little bit about, is that what happens should somebody who has COVID, who's had COVID, get the vaccine, and if there's any precautions that are needed to somebody who may be at this point recuperating and wants to take the vaccine?
So the recommendation for taking, that's a good question. If someone's had COVID, their immunity to getting COVID again is about 3 months. At the end of those 90 days, we would want them to get the vaccine. Now, Some people, as soon as they're testing negative for COVID, will get, if they're a healthcare provider, will get the vaccine earlier. But that immunity is about 3 months. You want to get the vaccine because just because you had COVID, it doesn't mean that you won't get it again. You can get it again and it can be more severe than the first time you had it. So it's just like the flu. You can get the flu and you can get it again. And so yes, you can get the vaccine after testing positive. Does that answer, I think, the question? There was a question about how soon can the vaccine trigger a seizure? The vaccine can trigger a seizure within minutes to hours to days. So we're not sure at this point. If someone's unstable seizure control, I would make sure you have something on hand. They may not get it the first day post-vaccine. It may be the next day or the day after. So depending on age and control of their seizure control.
I would like to ask, in addition to seizures, are there any other special considerations that maybe people should take into account? You mentioned how for some people, maybe Johnson & Johnson with the 1 vaccination versus the 2 doses might work for people. Are there other tips or ideas or anything you have when you kind of think about this community here that we're speaking to today that they might want to take into account when they're deciding how and when and where to get their vaccination?
So I think that the megapods are difficult for our client population to go to because there's significant waiting, which causes anticipation and anxiety when they're waiting to get a shot. So I would suggest either the pharmacy where you can have an appointment, or at the doctor's office, or a clinic where you have an appointment where they're not going to have to wait an enormous amount of time to get that vaccine. I think that's a really important thing, that they're not waiting around. That being said, if your only choice or your best choice is to get it at a mega clinic, then get it there. Just realize you might have to wait. I saw a question come out about breastfeeding moms. Can they receive it, and is it safe for the baby? Let's just say that we don't know at this point what effects it might have on the baby. I'm going to be honest with you. We don't know. Is it safer for mom to get the vaccine and not get sick and die? Yes. Same with pregnancy. We recommend getting the COVID vaccine at certain times during pregnancy, and we recommend that every pregnant woman talk with her medical provider about when is the best time to get the vaccine. The reason being is your immune system when you're pregnant is decreased. And so the chance of you getting COVID during pregnancy are high, and the ability to fight it is not there. We've lost a lot of pregnant moms who have been able to go under C-section and have the baby taken, and the moms don't survive. So my recommendation is to vaccinate. Breastfeeding moms, it's really up, they need to talk with their provider to decide whether it's safe for them and their baby to have the vaccine.
I think for maybe a final question here, we see a theme coming in as well. We spoke a little bit, you had spoken a little bit about part of the reason behind the vaccine hesitancy is the safety, and kind of that some people feel like maybe it was rushed, right? So we have, I think, about 3 more minutes of Q&A. I was wondering if in that time, if anyone could speak to the safety and the process that was taking place for the vaccine.
I guess
I'm sure
go ahead,
Janice can
Josh.
talk
Go
about
for it.
this, but the one thing or 2 things I would say about that is the vaccine still went through an FDA review process and clinical trial studies to confirm that they, number 1, are safe. That's actually the first thing the FDA looks at. And then number 2, of course, that they're effective. I also think if you just step back from less of a sort of scientific standpoint and look at the many millions of people around the world that have now had these vaccines, and we're not seeing, trends in that huge group of significant side effects that should cause us to think the vaccine's not safe. If anything, we're seeing the opposite, that the overwhelming majority of people who get the vaccine feel fine. Maybe as Janice talked about, sore arm and a little bit of a fever, fatigue, stuff like that for a day or two, but overwhelmingly they feel fine. So I also think we should realize that one of the reasons these vaccines came so quickly is governments around the world, including certainly in the US, put many hundreds of millions of dollars into their development. And so companies that normally don't work together, for example, work together to help get the vaccines out to the market. Producing the vaccines, which is actually one of the real challenges with vaccines. It's not just developing them, but then mass producing them. Again, there's been a tremendous amount of financial resources that have been funneled into that to help make all that happen. So if anything, I really look at how quickly they have become available as a medical miracle. That within a year of this pandemic, we had highly effective vaccines available to the world. That's pretty awesome.
Yeah, so I would say that the vaccine went through all of the same steps of everything else that goes through the FDA. They gave it emergency status for two reasons. One, they didn't have to do long-term studies to see how it's going to be 5 years from now, because that would be too long for us to make it valuable. And the second thing is, when it's emergency use approval, it's available and paid for by the government. Once it's approved by the FDA, it's going to cost a lot of money to each individual. So thankfully now you can get vaccinated and it's not going to cost you anything.
Thank you. And I think, Vicki, you had one more question that you wanted to answer before we move on. Thank you. Thank you, everyone.
Thanks, Amber. And I see there's questions coming in, and we've seen them in some other forums that we've been into about the issue of adult day programs and the closures. I just want to put it out there that licensing never issued anything regarding like a closure of a program. What we would say is that if you're starting to start delivering services again, that you adhere to the PINs that have been provided, and to also ensure that personal rights are taken into account. We've been really diligent about making sure that personal right is the highest and that folks still have access to services and every other right, including not being kicked out of a program or not receiving the same level of services based upon their choice as to whether they rejected the vaccine or took the vaccine. That being said, we are coming out with a PIN specific to adult day programs, just as a reminder PIN of which ones to look at. And to ensure that people have their mitigation plans in order. But if you're struggling with figuring out how you start that first step, please don't hesitate to reach out to the local adult and senior care regional office for licensing to help walk through that process. So again, appreciate all of you and having us here today, Amber, and hosting us in this, what a wonderful forum.
Oh, I can't thank all of you enough, and for taking this time to answer all these questions. I do see that there are a lot of questions coming in still into the Q&A. We are going to do our best to get to everybody's question, and we will be continuing this conversation and answering questions at our Lunch and Learn this Friday. So if you feel your questions haven't all been answered, we do hope that you will join us for that. And once again, just thank you to the entire team here for DSS, CCLD, and all of your partners here to bring us this really, really important information today. All right, we can go ahead and go back to the slides. Thank you. All right. So now I would like to start transitioning the conversation more specifically into the role of providers during this time and alternative services to support how can we support that education and getting the message out for those who do choose and do want to be vaccinated? And then how can we continue to see it through all through the vaccination process? So I'd like to introduce Jordan Lindsay with the ARC of California to speak more to this message. Thank you so much, Jordan, for being here.
Well, thanks very much for having me, and it's a real honor and privilege to be able to speak with everybody here today. And we've been hearing so much great information about vaccines. And what I'm going to specifically speak about is the role that us as a community, and especially service providers, direct support staff, but also individuals with disabilities and their families, can have in this rollout of vaccines for our community. You know, we all advocated so hard for our community to be prioritized in the eligibility for vaccines. And when that eligibility was given for March 15th, then it really became our responsibility. And when I say our, I mean everybody who is attending this webinar, our is a community responsibility to roll this out effectively for our community. And what is so important to know is that we have a great tool in our tool belt for assisting individuals in making decisions about vaccines, and also if they choose to receive a vaccine, in getting that vaccine. And that tool is alternative services. And that is ultimately what this project and these webinars are all about. And alternative services is something that was provided and granted by the Department of Developmental Services in response to COVID. And we pulled out here a section of the guidance that created alternative services, the directive. And there's a couple items I want to highlight in here. And it says it's to meet a consumer's service needs when providing services to consumers during the COVID-19 state of emergency. Providers shall be creative, resourceful, and make modifications as needed to how existing services are delivered. And they shall be responsive to each consumer's current needs and mindful of the importance of safety during the COVID-19 state of emergency. So alternative services allow for us to actually bill for and receive funding to help in the rollout of vaccines, as well as, of course, to help in safety as relates to COVID-19. So we have this tool. So let's talk about how we can use it together as a community. So in the DDS, the Department of Developmental Services directive, there was some ideas that were given about how alternative services shall meet the needs of individuals with disabilities. And highlighted here are a couple among the many that were in that the department provided. So the next slide will go into these two, and I just want to highlight those. Let's go to the next slide. Supports related to minimizing the exposure to or impact of COVID-19 on the consumer. Obviously, this can speak to many things like providing PPE, protective equipment, or providing information. But of course, this also talks about and can be applied to vaccines. So this allows for service providers that are vendored through regional centers to provide ways and information related to vaccines that can be billed under alternative services. Also, as we noted earlier in the definition of it, stressing to clients themselves and families that if you have a need that needs to be met creatively, resourcefully, that is not being currently met about COVID and or vaccines, then you can present your idea to a service provider, to your regional center, and say, this is how my unique needs need to be met right now as it's related to vaccines. And the regional center and service providers have this way now, this tool to use to find ways to meet your unique needs to get you the vaccine. Eligible alternative services continue to say that it can be safety precautions for both staff and the consumer. So this can also relate to vaccines, of course. Informed decision-making and developing written materials, and number G, delivering services in a manner accommodating the cultural and linguistic needs of the consumer. So next slide, let's dig into these a little bit, because this is really important. We've talked, of course, when it comes to item A, COVID-19 safety precautions. This is applicable to vaccines. Let's talk about this next one, which we highlighted, C. Informed decision-making so that consumers can understand what choices they have in receiving services and understand the benefits, risks, and responsibilities associated with the service choice. We have just been talking about, and there's tons of questions, as we've already seen, about vaccines. You as a service provider or a family member have the role now to provide information to a consumer so that they are making an informed decision about vaccines. Not only do you have this responsibility, you have this tool, alternative services, where you could actually be reimbursed for providing this. This is a service now under alternative services. And this is critically important. I want to spend just a moment and pause on informed decision-making. We as a community, the intellectual and developmental disability community, have a long history and has been brought up in this webinar. It's been brought up in multiple discussions around vaccines, that there is a history within our community of individuals not having the ability to make decisions when it comes to their health and or medical procedures, medical processes that have happened in the past. Let's make sure that this time with vaccines, we know that individuals are making informed decisions, and you have a role in that. So let's talk about how you can have a role in that as well. Next slide. Alternative services can also apply to developing written materials using plain language that can be readily understood by consumers, and delivering services in a manner accommodating the cultural and linguistic needs of the consumer. Our responsibility is to provide information about vaccines that is in plain language so that individuals can understand the decision they are making, and of course, in a cultural and linguistic competent manner. So this is not only our responsibility, but again, going back to alternative services, this is a tool we have now. These are services that you can provide and bill for, be reimbursed for. These are now services eligible to be billed for to the regional center. So let's make sure that we are doing everything possible in reaching out and even showing this recorded webinar to a client could be considered an alternative service now, so that they have information, that you are providing them information about vaccine safety as it relates to COVID safety. Next slide. And just to make sure everyone is confident in this, DDS just recently released an FAQ about alternative services. And as you can see in the question 12, can alternative services include assistance with accessing the COVID-19 vaccine? The answer from the department is yes. Assistance could include providing information about the vaccine, eligibility, where to obtain a vaccine, and coordinating transportation. So these are some of the ideas. Let's go to the next slide. I want to highlight, this is something that's happening right now. And I have the permission to highlight this. This is Home of Guiding Hands and FACT and others down in the San Diego area who are currently right now coordinating transportation and coordination for vaccination appointments. And this is a flyer that they have on the left, and we're highlighted a couple sections on the right. So free transit rides to and from the vaccination stations or other locations, and facilitating access to coordinating transportation. So this is one example that is happening right now of how service providers are using alternative services to provide transportation and other supports as it relates to vaccines. Next slide. What are some other, and going back to the original definition of alternative services, resourceful, creative ways that we can meet this need, this moment right now? We've already talked about transportation, talking about educational resources about vaccines. There's lots of great resources that have been developed out there. Many of the organizations that are part of this project have developed great materials that can be shared with your clients, your families. Supported decision-making. If you are unfamiliar with the process of supported decision-making, which is often considered an alternative to conservatorship, but it is a decision-making process. And you can go to our website at the ARC of California's website, thearcca.org, or you can simply Google supported decision-making, and you can find ways, processes, strategies to help a person make a decision about a vaccine. Translation of vaccine information. We talked about cultural competency. Are you reaching out and creating that outreach mechanisms to all of your communities so that they have that information available? A clinic site. This is something else for you. This is specifically for service providers on this webinar. Have you reached out to your county and coordinated with the regional center in your county public health office? Can you be a clinic site? Many service providers that I know within our the ARC chapters, United Cerebral Palsy chapters that we work with, are already working on this with their counties and regional centers to coordinate that. There are other examples as well. Is that a role that you can play so that you can have that direct connection with the county and with your clients and families? And then question mark. There are more out there. These are just ideas. Alternative services offer flexibility and resourcefulness, creativity in this. What are the unique needs of the individuals and how can you meet them? And that can be done under alternative services. Next slide. These are a few of the directives and FAQs that have been put out by the Department of Developmental Services. We appreciate and thank them for putting out this guidance to our community. And the next slide, and if you have questions on any of these, we can get those to you. The next slide, also we want to highlight that the Department of Developmental Services has directed regional centers to provide the personalized letters about eligibility, which for regional center clients, all regional center clients, began March 15th. Also conduct outreach to consumer ages 16 and over, where to get vaccine, how to schedule appointments, options for assistance, and also that those most at risk should be prioritized. So this is something that your regional centers should be doing, and please partner with them in this effort. This is, next slide. And I want to also, as we wrap up with some of the CDC and public health recommendations, emphasize that this is really a community response. This is not just the regional centers' responsibility or the county's responsibility or the state's responsibility, although they do play a critical role in leadership for this. But we as a community all have a role in this to make sure that there is equity, for the rollout of vaccines, that there is informed decision-making happening, and that we are ensuring that as many people as possible in our community who want to get the vaccine are getting that vaccine right now, especially during this time of eligibility and prioritization. I want to thank everybody for being on this important webinar, and happy to answer questions.
Thank you so much, Jordan, for your time here today, and really appreciate, the themes that came out of that. The fact that it really is, it's going to take all of us to be able to support those who do choose to get it right, from the informed consent all the way through the access. It's going to take all of us to make sure that people have what they need and are able to get it in a way that's going to work for them. And so I appreciate all these resources that you have provided to the community. Next slide, please. I want to make sure that everyone leaves this webinar today with all the resources that you need to be able to support this effort. And the first is, as I mentioned earlier in today's webinar, we do have more webinars coming, specifically speaking to the broader community in regards to vaccination education. So as you can see here, we have 2 back-to-back, Wednesday, April 14th and Thursday, April 15th. And the first one is in English and will be interpreted in Spanish and ASL. And the second one will be in Spanish with English interpretation. So if you're available only one of the 2 dates, there still will be access for everyone who is interested in joining those webinars to get additional education. The topic specifically is the COVID-19 vaccine and what it means for the disability community. As more people across the state receive immunization, communities will slowly be able to return to normal. Californians with intellectual and developmental disabilities are now eligible for the COVID-19 vaccine, but information about the vaccine itself might be confusing or raise concerns. Whether you have a disability, have a family member with a disability, or provide services to someone with a disability, you need the facts. Join these webinars to hear directly from doctors about what happens in your body when you get immunization and possible side effects, how the vaccines were developed so quickly in this pandemic, and who makes sure the COVID-19 vaccines are safe and effective. Some of this, as you see, may have a little overlap here, but these webinars will go more in depth into a lot of the questions those of you here today might have, and also for those of you, in this community. So please do get the word out if you know people who are looking for this information. Next slide, please. In addition to the webinars, we have the upcoming Lunch and Learn this Friday, where we will be continuing to answer your questions. You can sign up at lunchandlearn.disabilitythriveinitiative.org. Also, please reach out to us for resources, and if you need any assistance, there are many resources available and there are many ways to contact us. A good place to start is from our website, disabilitythriveinitiative.org, or signing up for our email list at signup.disabilitythrive.org. Also, if you would like help providing the alternative services you desire, we would love to help. You can reach out for technical assistance at Disability Thrive Initiative Zendesk.com. Next slide, please. We do also want to make sure you have more COVID-19 resources and have included a few more slides here. You can find access to all of these not only through the links that are provided in the chat today, but the recordings, both in English and Spanish, as well as the slides, will be available on our website shortly. You will find educational toolkits on COVID-19 and the vaccine. You will find resource materials in plain language, as well as informational videos addressing the specific COVID-19 vaccination concerns of underserved communities. Next slide, please. Thank you again for attending today. We ask that as you leave the webinar, you please provide us feedback through a quick survey. And finally, please feel free to contact us by email at info@disabilitythriveinitiative.org or our phone number, 916-238-8811. We look forward to hearing from you and seeing you at our future webinars. Thank you so much.